Hi, everybody. In this chapter, we want to talk about the healthcare, and disability, chapter 4 in the course of Sociology, SOC 1010. At first, again, we have some questions for deeper thinking. Why is an affordable and accessible healthcare system such as a vital component in a society? Is there a healthcare crisis in the United States and worldwide? And what are the arguments for and against a universal healthcare plan? Also, now we are talking about health and health-related problems in the crisis of COVID-19. But when the book was written by the author, it was a general speaking and general discussion about the universal healthcare system. Also, before and after President Obama in America, we want to talk about it, that in high-income countries like the United States, while sometimes these countries, also like the United States, has reached to the universal and overall healthcare system so late, in contrast with some, especially Northern European countries like Scandinavian, Sweden, and Norway, and Denmark, and Finland, with a high quality of free of charge for everybody healthcare system. On why America has reached so late with this level of healthcare system, only about, I think, 2019 to 2010. Yeah, 2010, that President Obama signed the act for Obamacare and healthcare system for a lot of people as free of charge systems. And chapter outlined about health in global perspective, health in the United States, healthcare cares in the United States, sociological perspective on health and medicine, and a good discussion about mental disorders and mental illnesses. And also the final part is about a very, very short discussion about disability. Again, we have 8 questions about this, the topic of this chapter. We call it always Sociology and Everyday Life. And the second title is related to the main title of that chapter, because this chapter is about health and health-related problems. From a sociological perspective, we want to talk about medicine as a social institution. Sentence 1 is, the idea that everyone should have guaranteed health insurance coverage is accepted by nearly all Americans. How do you think about it? Is it true or false? The idea that everyone should have guaranteed health insurance coverage is accepted by nearly all Americans. Is it true or false? No, it's false. Worldwide, most HIV infections are spread by homosexual contact. How do you think about this sentence? Worldwide, most HIV infections are spread by homosexual contact. Is it true or false? Again, is it false? The primary reason that African Americans have shorter life expectancies than whites is the high rate of violence in central cities and the rural South. Is it true or false? We are talking about the life expectancies. And at the other hand, we are talking about violence, aggression, civil and organized aggression, mass killing, mass shooting sometimes. Is it true or false? Also, there is no logical relatedness between life expectancies and shooting and killing and aggression. The most common cause of death among Americans aged 15 to 24 is unintentional injuries. Is it true or false? This is true. Number 5, healthcare in most high-income developed nations is organized on a fee-for-service basis as it is in the United States. Healthcare in most high-income developed nations is organized on a fee-for-service basis as it is in the United States. How do you think? We talked about it very short some minutes ago. How do you think about it? Is it true or false? No, it is false. Because in high-income developed nations, developed countries, industrialized countries, yes, everybody can have a good and free of charge, not fee-for-service charge basis like America. The medical industrial complex has operated in the United States with virtually no regulation, and allegations of healthcare fraud have largely been overlooked by federal and state governments. How do you think about it? The medical industrial complex has operated in the United States with virtually no regulations, and allegations of healthcare fraud have largely been overlooked by federal and state governments. True or false? This is false. Number 7, about medicine as a social institution. Media coverage of chronic depression and other mental conditions focuses primarily on these problems as women's illnesses. Is it true or false? We are talking about the gender bias to some mental disorders, like anxiety disorders, like personality disorders, and especially here about depressive disorders or depression or bipolar and sometimes unipolar disorders. Is there any gender bias? For example, majority is for women or majority for men or not? No, absolutely, this is false. And the final sentence is about 2/3 of US adults are either overweight or obese. Is it true or false? 2/3. Unfortunately, it is true. About 2/3 of US adults are either overweight or obese, more than 10% or 15% than regular natural BMI, body mass index. Now we want to talk about health in global perspective. There's a very formal organization to administrate the health-related problems, the health-related issues, also illness-related issues, also pandemic, like coronavirus pandemic all around the world. There's a very formal related organization about discussing and managing and assessing and evaluating the health conditions all around the world, which is called World Health Organization. It is WHO. Only 3 years after ending World War II, WHO was established, was organized. And the first thing was that they want to know and to define what is health, because the organization was about health organization, World Health Organization. In the first definition provided by WHO, they said, health is a state of complete physical, mental, and social well-being, 1948. Health is a state of complete physical, mental, and social well-being. And healthcare is any activity intended to improve health. So, in a very short definition of healthcare, we have 3 major keywords. At first, it's an act, it's a behavior, it's an observable behavior. Secondly, it should be intentionally intended. And what is the goal of healthcare? Health improvement. So healthcare is any activity intended to improve health. And finally, we want to talk about medicine. Medicine is an institutionalized system for the scientific diagnosis, treatment, and prevention of illnesses. Primary prevention, secondary prevention, and third level prevention. So it is called medicine. Medicine is an institutionalized system for the scientific diagnosis, treatment, and prevention of illness, mental illness or physical illness. So medicine is a science. What are the goals of medicine? Diagnosis, treatment, and prevention. Also follow up another parts of some subcategorization of prevention or treatment. But it's a science and institutionalized system for the scientific assessment, scientific evaluation, scientific practice against the illnesses, or scientific practice for health and health-related improvement issues. And also we have two overgeneral phrases here. One, life expectancy, and second, the infant mortality rate. What is life expectancy? Life expectancy refers to an estimate of the average lifetime of people born in a specific year. What are our keyword at first? Life expectancy is an estimation, is a prediction. Only for those childs who were born in a specific year and in one geographical or cultural or racial or ethnical area of people. For example, most deaths in low and middle income nations are linked to infectious and parasitic diseases that are now rare in high income industrialized nations. Among these diseases are tuberculosis, polio, measles, diphtheria, meningitis, hepatitis, malaria, and leprosy. These are the major killing and mortality rising rates in the middle and lower class nations, not in the high income nations, not in the over industrialized nations or countries. In the very, very poor countries, but a lot of these diseases, we cannot see them. For example, in America, in North Europe, in over-industrial, in Britain, in France, cannot see them. For example, tuberculosis or meningitis or some malaria. Meningitis is some infection, but about the parasitic diseases, we cannot see a lot of them in the high-income countries because a very good preventive, not treatment, preventive, before become an ill. Preventive, especially primary prevention. Primary prevention includes, for example, vaccination. Vaccination is a type of primary prevention. Prevention at the level to prevent you to become ill. And secondary is something like treatment. You are ill. Secondary is prevention, preventing to become more severe or much more ill with more problems. And tertiary prevention is called some activities for follow-up, for getting better, for coming back to health situation, the primary health situation or a general health situation. It is prevention at the third level. And the infant mortality rate is the number of deaths of infants under 1 year of age per 1,000 live birth in a given year. Expectancy, life expectancy, is the estimation about the years that one can have stay alive for a period, for a given for a specific year, and in the opposite, we have the infant mortality rate. The World Health Organization in 2009 estimates that 2/3 of those infants die during the first month of life. 2/3 of the children, of the infants that die in the first year of their age will die at the first month. So the highest risk point, the highest risk age for stay alive and not stay alive is the first month, and after the second 11 month, totally the first year. But the highest risk, the critical period, is the first month. 2/3 of the infant mortality occurs in the first month, and other parts in the next 11 months, total is in the first year. Many reasons for differences in life expectancies and infant mortality. Why? Why we have different time for life expectancies all around the world between and among the different countries and different geographical and political and racial and ethical and sometimes cultural and religious different areas. Why? What are the factors, determining factors? At first, insufficient or contaminated food. No food, no sufficient food, no healthy food. Yes, higher rate of mortality for infants or lower years for life expectancy, especially as lifestyle. Food and eating is a major important part of lifestyle. It is a large effect on long-term life expectancy. Lack of access to pure, safe water. All around the world, safe water, pure water, drinkable water is very important. Water is everywhere on the surface of Earth. 70% of Earth includes water, but this water is not good water for human being, for drinking, for washing. So pure and safe water, another item. Not to have adequate sewage and refuse disposal. A lack of information about how to maintain good health. It is very important. This age is age of information. It is not age of capital. It is not age of industry. It is not age of science even. It is the age of information. So a lack of information about how to maintain good health is one of the greatest factors influencing the rate of mortality, influencing the years for life expectancy and other parts. Lack of qualified physicians, sometimes also, and lack of up-to-date healthcare facilities. Epidemiology. Epidemiology is the science of statistics and science of rating of different aspects of human being life. And social epidemiology is the study of causes and distribution of health, disease, and impairment throughout the population. So we are talking about causes, especially honestly, epidemiology is not something about causes, about the etiology. Etiology is the scientific study of causes in medicine and psychology and other parts of science, human sciences, we say etiology. Epidemiology is not about etiology. Epidemiology is about distribution. More than causes, it discusses the distribution. This is the study of causes and distribution of health, disease, and impairment throughout the population. And social epidemiology targets. What are the targets? At first, disease agents. 2, the environment. And 3, human host. What can we talk about? Disease agents include biological agents such as insects, bacteria, and viruses that carry or cause disease. Nutrient agents such as fats and carbohydrates. Chemical agents such as gases and pollutants in the air, and physical agents such as temperature, humidity, and radiation. And the second part and the second target of social epidemiology is the environment. Include the physical, geography and climate, biological presence or absence of known disease agents, and social socioeconomic status, SES, occupation and location of home and environment. So it includes physical, biological, and social environment, as you know. And one of the good definitions for multi-dimensions of human being, it is called human being is a multi-dimensional being. For it is bio, psycho, socio-spiritual, biological aspect, psychological aspect, sociological aspect or social aspect, and also spiritual aspect or moral aspect sometimes it is called. And the last part and the last target is human host. The human host takes into account demographic factors like age, like sex, like race and ethnicity, physical conditions, habits and customs, and lifestyles. Let's look at briefly some of these factors. What is chronic diseases? Chronic diseases, in opposite of acute diseases, are illnesses that are long-term or lifelong and develop gradually or are present from birth. It is chronic, long-term from birth until the ending years of your life. And acute disease, for example, at first we should define acute disease. The acute diseases are illnesses that strike suddenly and cause dramatic incapacitations and sometimes death. So what are the keywords in definition of acute disease? At first, suddenly, sudden strike, dramatic, and sometimes death. It's very dramatic signs in a short period of time. Sometimes will end to the death, and sometimes with a lot of suffering, with a lot of pain. But it's a short term. For example, seasonal problems are acute. But in chronic problems, the severity, always, not always, but in more cases, the severity is lower than acute diseases, in chronic diseases. But it needs changes in lifestyle. For example, diabetes, asthma, sometimes cancer, HIV, all are chronic disorders. And some operations, surgery operations, like for example, CABG. CABG is an open heart, invasive heart surgery. And after that, you should change your lifestyle. Stress is very killing, as the Robert Sapolsky in Stanford says, he calls stress as a portrait of a killer. You can see the movie Stress as a Portrait of a Killer in YouTube from Robert Sapolsky from Stanford, okay? For example, if you want to work seriously on your stress management, it shows that you have a chronic disorder and you should change your lifestyle and your confrontation and your problem solving strategies, coping strategies, and other parts in the long term and a long period of time, not in the short term, because you need to change your attitude to the world, to yourself, to your behaviors, to your future, to your present moment, and other parts of your lifestyle. It is called chronic disorder diseases. And in management, in business, in psychology, in sociology, one of the greatest problems in human being health system is chronic disorder. Even sometimes in some part of the world, like also America, aging is becoming a chronic problem. The chronic disorder is a chronic problem. Why? Because, for example, in my country, Iran, we have about 50% of people under the age of 30. One of the youngest country all around the world is my country. But after 40 years, we will have a lot of people at the age of 70. So in my country, we should have some strategic plans for providing for aging people, because after 40 years, these population, a very young population, will be old people. In America, we are at the end part. It is estimated after 10 years, 1 out of 5 white American people will have Alzheimer, memory problems, memory serious problems, and also geriatric problems. Geriatric is the part of medical science that talk about aging, talk about elder people. It is called geriatric, and other discussions about chronic disease and chronic disorders. And lifestyle factors, drug use and abuse. What is drug? A drug is a substance that, when taken in the body, alerts its functioning in some way. Sometimes it is called psychedelic, and it is substance, it is drug. It should change your daily functioning, short term or long term, downing or high or ecstasia or euphoria or no, sometimes dysphoria. It's different. For example, the effects of alcohol is different from effects of marijuana, and the effects of, for example, cocaine or heroin and opium and other parts. Each of them has a specific exciting or retarding effects, but all of them are substance or drug. Alcohol, nicotine, and sometimes illegal drugs. Illegal drugs are the same drugs that it is not usually, you cannot find them as the formal drug for medication in the pharmacies. Their usage is out of the pharmacy always. It is illegal drug. And other parts and other item, other factor of lifestyle is STDs. For example, HIV and other, for example, HPV is the STD, maybe STD. And diet and exercise, as you know, sex, food, and substance are the major part of the lifestyle. Also, exercise is underlying a lot of factors. For example, regular exercise, regular sport, daily exercise produces a good foundation for changing your food diet, your smoking, your alcohol, your substance use and substance abuse. So now in psychology, in health psychology, and in sociology, and also even in every type of coaching, as life coaching, executive coaching, business coaching, performance coaching, even sometimes in spiritual coaching, there is a very, very high emphasis on the body-related problems, especially in daily practice. It is highly recommended to every type of coachee that they should have a regular, good, especially aerobic daily practices. Why? Because your drug, your alcohol, your smoking, your diet, your overeating, your binge eating, your depression, your anxiety disorders, your sexual problems, and other, at the base is relative to your mind, and mind is to your brain, and your brain is a part of your body, and the sound mind in a sound body. You can see some graph here, percentage of adults who binge drink. Binge drink is meant, it is not regular drinking alcohol, but each time you drink and drink and drink and overdrink and binge drink until you go out of the natural and normal and safe behaviors. It is binge drinking, like binge eating. When we are using the word binge, it is related to lower rates of repetition, the usage, but a high usage in each time, in each turn of usage. And also the average largest number of drinks consumed by binge drinking and single occasion, different states of America. Also, In 2020, the U.S. Food and Drug Administration, FDA, has required that all cigarette packages carry a vivid color image about tobacco-related cancer disease and warning about the negative consequences of smoking all around the world, not always in America. All around the world, after 2020, it is mandatory and illegal, and they should have some vivid color image on the packet of cigarettes to announce about the dangers, health-related dangers of smoking, especially about cancer, about your mouth, about your lung, about your breathing, especially about the cancer related, smoking cancer related. Also, it is only legal and it is an announce and alarm. It is not mandatory for the consumers or for producers that to do anything specific for using or not using smoking. It is only a commercial announcement for the consumer that, hey, you are smoking, and this should be a good alarm for you to stop smoking, to quit smoking. And do you think that warnings such as these will help reduce the rate of smoking and tobacco-related death in the United States? You can see here, it's brand warning, cigarette cause cancer, and you can see the label on the cigarette. And rate by age and sex, 2020, chlamydia and adult obesity in the United States, 2020 again. And in 1910, there was a good research, conducted research about the medical education, medicine education in the US and in Canada. And after that, until now, after near 110 years, the results and the protocol and the design provided by that report is also usable for different policymaking sections for medical education and other medical groups education. In a landmark report of medical education in the US and Canada, written by Abraham Flexner, it is called Flexner Report, and published in 1910 under aegis of the Carnegie Foundation, many aspects of the present-day American medical profession stem from the Flexner Report and its aftermath. As a result of this report, white women and people of color were largely excluded from medical education for the first half of the 20th century. Is it discrimination? Maybe. It is gender bias. A lot of physicians should be male, not female. Maybe. It is racial bias. A lot of physicians should be white, not from Mexican people, not from black people, not from Asian people. Maybe. And after that, until the civil rights movement, it's a very great movement in America, and also in the recent protests in Los Angeles, in Washington, D.C., and other parts with the motto of Black Lives Matter. And the previous movement, a very serious movement, women's movement and civil rights movement in the 1960s and 1970s, virtually all physicians was women's movement of the 19th. Virtually all physicians were white, male, and upper middle class. And now we want to talk about scientific medicine and professionalism in medicine. When we are talking about professionalism, we have these characteristics, we have these features. At first, abstract specialized knowledge. Who is a profession? Someone who has knowledge. What type of knowledge? Abstract knowledge, not always objective knowledge. It's a subjective, intellectual knowledge, and specialized knowledge. Very, very narrow knowledge about a lot of knowledge about the very little things, very small things. Autonomy also, self-regulation, authority, and you cannot be in the medical group. You cannot work in the medical group with a very, very deep altruistic features. You should have very deep sense of altruism. Without that, you are a good human being, but you cannot be a good physician. You cannot be a good social worker. You cannot be a good nurse. You cannot be a good psychologist and other parts of human-related therapeutic or service-oriented jobs, or I would say medical group jobs. Altruism is the basic part of every service for human beings. Without altruism, we cannot do anything with a high quality service. And also you can see here the picture of President Obama, the Affordable Care Act in 2010. After that, America joined other high-income nations in offering universal health care when President Barack Obama signed the historic legislation on March 23, 2010. Now we are talking in 2020, after 10 years. Fee-for-service approach, fee-for-service, service and money, money and service, science for business and business for science. In capitalism, we can see it. Sometimes it is not moral, sometimes it is not fair, sometimes it is not humanistic, yes, but as for a capitalistic approach, it's very good, and some advances in medicine, especially in America, in pharmacy and pharmaceutical science in America, some part is related to the capitalistic approach. Why? Because it is true that a lot of people that they are in the lower middle class of economy, they cannot have a good access to medical services. But finally, gathering a lot of money is a good service for education, medicine education. One of the greatest, one of the best medical education and medical universities all around the world are in America. And also for pharmaceutical industry, pharmacy industry, it is very important to have a good money. And this capitalistic approach to medicine, also in the Department for Improvement and for Research and Development and other part of medicine, is very good. Throughout its history in the United States, medical care has been a free-for-service basis. Patients are billed individually for each service they receive, including treatment by doctors, laboratory works, hospital visits, prescriptions, and other health-related expenses. It is individual payment. Fee-for-service is an expensive way to deliver healthcare because there are few restrictions on fees charged by doctors, hospitals, and other medical providers. Good sides are that in the true spirit of capitalism, coupled with the hard work and scholarship of many people, capitalism, hard work, and professionalism. This approach has resulted in remarkable advances in medicine. But bad sides it is about an inequality of distribution. Health maintenance organization or HMOs provide for a set monthly fee total care with an emphasis on prevention to avoid costly treatment later. These are health maintenance organization, and managed care is any system of cost containment that closely monitors and controls healthcare providers' decisions about medical procedures, diagnostic tests, and other services that should be provided to patients. It is managed care. This is very important. It is a win-win game for provider and for the consumers, for money gathering, for money making, and also for money rotation and refunding some cost to the customer, to the clients, sometimes to patients. And medical care in other nations like Canada, Great Britain, People's Republic of China, universal health care, what signed President Obama in 2010, is a healthcare system in which all citizens receive medical services paid for by tax revenues. It is universal health care. One of the greatest and best examples for universal health care is Sweden. It is one of the greatest, number one provider for medical services in Sweden. Socialized medicine is a healthcare system in which the government owns the medical care facilities and employs the physicians. It is socialized medicine. There's nothing very important part for private practice because everything is under control of government, and government pay good money also to physicians. But you cannot see a lot of physicians to do private practice. Why? Because maybe they don't have any uh, private client and a private patient. Everybody goes to hospitals and hospitals for government and other parts. Social implications of advanced medical technology. Advanced technology create options for people and for society. But these options alter human relationships at first. Options for treatment, but alter human relation. Two, advanced technologies increase the cost of medical care. Thank you for advances in medical technology, but you should pay more money to use the technologies. And advanced technologies such as cloning and stem cell research raise provocative questions about the very nature of life. It is very basic. And as you know, we have medical ethics and ethical issues in all aspects of working with human beings, especially in medicine, because sometimes the work and the manipulation is very, very deep, very crucial, very radical, and in a lot of time, if you cannot consider the ethical issues, wow, we don't know where we are going to. It can be a catastrophe for human nature as a basic part. So it's a great question about how much is eligible, how much is good to use the advanced technologies in medicine and in medical research. So we have holistic medicine. Also, it is holistic, not holistic. It is holistic. It is sometimes too holistic in the spiritual. I don't know why. When we use holistic medicine, we use it with H, not with WH. But holistic medicine is an approach to healthcare that focuses on prevention of illness and disease and is aimed at treating the whole person rather than just part in which symptoms occur. It is the Eastern medicine, it is the Oriental medicine. It's a very total approach, a multidimensional approach to human problems and also to human health. And functionalist perspective, they say the sick role is a set of pattern explanation that defines the norms and values appropriate for individuals who are sick and for those who interact with them. It is very important. In a large part of medical system, healthcare system, even other parts of every issue for human beings, health-related human beings, we have passive and active. For example, active smokers and passive smokers, someone who interacts with the sick people. People who are sick are not responsible for their condition, the first one. Two, people who assume the sick role are temporarily exempt from their normal roles and obligations. Temporary, not always. People who are sick must want to get well. This is the third assumption. And people who are sick must seek competent help from a medical professional. These are the major part of functionalist perspective on healthcare system and medicine. And conflict perspective as another perspective in sociology, in sociological studies, studying and investigation about everything, it is conflict perspective. The medical industrial complex encompasses local physicians and hospitals as well as global health-related industry, such as insurance companies and pharmaceutical and medical supply companies. Encompasses together. It is conflict perspective. And symbolic interactions perspective says medicalization and demedicalization. What is medicalization? Here is medicalization, sorry. Refers to the process whereby non-medical problems become defined and treated as illness or disorders. For example, a lot of mental illnesses, at first they are not illnesses, they are not disorders, they are not diseases, they are only personality traits. But after severity, it is medicalization. Our approach to those traits, or even substance, for example, substance addiction, at first, in some parts of the world, they think that no, it is not an illness, it's a crime. And in some other parts, they say it's legal, it's not illness, it's not a crime, it's a choice, and sometimes it's a chance. And in some parts in medical approach, they do medicalization and say no, it is not a choice, it is not a chance, it is not nature, it is not a crime, it's an illness, it's a disorder. As we can see, for example, substance-related disorder as a major part of mental illnesses, or sometimes medical illnesses, sometimes somatic illnesses. And demedicalization is the other part of medical, refers to the process whereby a problem ceases to be defined as an illness or a disorder. For example, in homosexuality until 1986, there was a category in the mental disorders categorization. Some, for example, same-sex relationships or homosexuality. After that, it is demedicalization. The professional says that, no, it's a choice. It's not an illness. It's for example, a chance or choice. It is your personal choice also, with a lot of biological and cultural and sometimes personality-based features and traits. And for example, in gambling, you see that gambling, sometimes it is called pathological gambling. It is medicalization. Sometimes the chance and recreation, it is not a problem. It's not a pathological problem. And the last part, it is about mental illness, mental disorders. And is there anything so-called mental illness? Thomas Suss talked about it at first, about the mental illness, and a very good book with the title of The Myth of Mental Illness. Mental illness affects many people. However, it's a difficult topic for sociological research. Social analysts such as Thomas Suss, 1984, have argued that mental illness is a myth. According to this approach, mental illnesses are actually individual traits or behaviors that society deems unacceptable, immoral, or deviant. So something you are called mental disorder, it is not mental disorder. It is socially unacceptable behavior. If society accepts them, it is not called mental disorder. According to Suss, labeling individuals as mentally ill harms them. Why? Because they often come to accept the label and are then treated accordingly by others. So, labelizing also in this approach, because we have a lot of books about the labelizing and about the Diagnostic and Statistical Manual of Mental Disorder, DSM, on International Classification of Diseases, chapter, I think, 4 or 6, it is about behavioral and mental disorders, international classification of diseases by WHO and other organizations that define different categorization of mental disorders. But in this approach, especially as the sociological approach to mental disorder, there's nothing so-called mental disorder or mental disease. Why? It's a social labelizing, because even it is not statistical normal. It is out of the normal of the society. It is not socially acceptable. If it is socially acceptable, sometimes, not always, sometimes it's not called mental disorder. And many scholars believe that mental illness is a reality that has biological, psychological, environmental, social, and other factors involved. Many medical professionals distinguish between a mental disorder and a mental illness. A mental disorder is a condition that makes it difficult or impossible for a person to cope with everyday life. It has two criteria. First, daily dysfunction and distress, feeling of distress, or daily dysfunction. You don't have any good educational, occupational, interpersonal, and social, and sometimes spiritual functions. No education function, for example, in depression, occupation function in aggression and personality disorders, and interpersonal antisocial personality disorder, or sexual related disorder, or sex related disorder, or substance related disorder. All the categorization, all the titles of mental disorders at first has one of these features at first. This or that or both of them. 1, daily dysfunction. 2, distress. Both of them or at least one of them. And mental illness, a condition in which a person has a severe mental disorder. This is a different. Mental illness is more severe than mental disorders. Mental illnesses, they are called mental illnesses. They need hospitalization, psychotherapy, pharmacotherapy, and sometimes medication, very, very serious medication. It is mental illness. And deinstitutionalization refers to the practice of rapidly discharge patient from mental hospital into community. It is a movement, an intellectual movement, and very therapeutic movement that they said it is not necessary to stay for a long time in hospital as people with mental disorders. They should go very rapid. They should go back to the society, to the community, and begin coping strategies with together the new features of mental disorders and coping those features with their community and go back to the normal life. And final disability refers to a physical or mental impairment that substantially limits one or more major activities that a person would normally do at a given stage of life, and they may result in stigmatization or discrimination against a person with the disability. So you are reading and studying sociology. In this course, everything you are looking at, everything you are studying, everything you are thinking about, it should be from the perspective of sociological problems or sociological aspects. One of them is disability. Okay, so physical disability, mental disability, sometimes social disability, emotional disability. Okay. But the major part of disability from the sociological aspect is stigmatization. In a large number of countries, large number of cultures, large number of societies, disability will be stigmatized. It is a stigma. It is not socially acceptable situation, socially acceptable trait or feature. It is disabled, not able. It is not capable. It is disabled. It is had a lot of extra cost over the general population, regular cost, and discrimination sometimes against them. That like other discriminations, it's about minority. Also, a lot of people doesn't have any disability, any objective disability. Objective for a few people, but they are in the minority. And as a minority, we know that we have also some discrimination against disabled people. But during the 40 years ago, all around the world, especially in North America and in the Central and North Europe, we have good movement, good activity for protecting disabled people, also for color skin people, and also for aging and elder people. Thank you for joining me for this chapter. I hope that this chapter you have a good primary socially observation to the health and healthcare system from the perspective of sociology, not from the perspective of, for example, psychology or business and management. I know that a lot of you want to enter to management the healthcare system. These basic concepts is very important for you if you want to be a healthcare manager or a healthcare activist or healthcare leader in the future as a manager, as a graduate and undergraduate of management science or business science. These topics and these concepts, basic concepts, are very good for you to use in your future job and your future attitude to healthcare system. Have a good time. Bye.